My name's Debbie Sorkin. I chair the Healthy Places subgroup of the Place Alliance, and I'll be your chair this afternoon. Where you live can seriously damage your health. We know there's an evidence base for this. We know it's informed, for example, Sir Michael Marmot's work. And those of you who were in the Healthy Places Making These Happen session earlier will no doubt have heard of these. Most recently, Sir Michael has talked about this in his book, The Health Gap. And if anybody hasn't read this, I really recommend that you do. One of the things that he says is that actually this is a choice for us. It's a societal choice. It's a political choice. He says, I will make the case that our social arrangements are crucial to the level of health in our society, and the wider determinants of health are what go towards this. So, if you're a planner, if you're a developer, if you're in any aspect of health, what can you personally do about this? Well, with us this afternoon, we're lucky enough to have 3 people who'll be able to talk about exactly what you can do in practice, as well as raising further questions and pointing out places where this is already on display. In order, we have Richard White, who's a wider determinants of health specialist at Wolverhampton Council, and he'll be talking specifically about the wider determinants of health and how he's applied these and other aspects of placemaking in Wolverhampton and other places. Secondly, we have Mike Westley of Westley Design, who also lectures in architecture at Plymouth University, and he'll be talking about green infrastructure and well-being, drawing on research and practice, and how these can inform both healing and learning. And finally, we have Marcus Wilshire, who's a studio associate at IBI Group. They've been advising the NHS and others on the Health in New Towns programme, and he'll be drawing some of the learning from that programme, particularly about how you apply design perspectives. Each of our speakers will speak for a maximum of about 15 minutes. I'll ask them just to follow on from each other, and we'll then have lots of time for questions and debate at the end. I'd ask if you can hold your questions till the end, that would be great. Thank you very much. So without further ado, I'm going to invite Richard White to talk about the wider determinants of health. Thank you.
Fantastic to be here, I have to say, and it's great that public health, we're getting involved in the placemaking agenda, traditionally around kind of place, around planning, but really what I'm talking about is why is public health interested in this? And I guess really, as you look at the kind of the wider determinants of health diagram by Hugh Barton and Marcus Grant, we look at that through how can people have adequate access to green space? Can we design our neighbourhoods so children are safe to roam? How can we work with our transport engineers to do that? How can we adapt spaces to support ageing populations? And who gets excluded from local facilities? Why? And how can that be changed? I think in the West Midlands context, we're dealing with a whole range of health issues, especially epidemics with obesity and inactivity, smoking-related harm, gambling-related harm, air pollution, a major issue. The number of deaths across the West Midlands from NO2 and particulates is quite high. The effect of ageing populations in the future and how we adapt to that. And also a major agenda that's coming forward is the mental health and well-being agenda, which is great that is being pushed by our emerging combined authority through a commission which was led by Norman Lamb. So there's a few good recommendations that came from that were published at the end of January. And how does that link to the built environment? Well, it links in areas of how our spaces are designed, how they have been designed, perhaps how our street infrastructure has permitted some areas of has led to inactivity, how that has had a knock-on effect for local areas and the urban landscape, the streetscape, with the proliferation of certain premise types and how that can impact people's lifestyle choices, and really about how that has a knock-on effect in areas of housing as well, in terms of house design and how we try and influence that. And I like to think that public health has a kind of a critical friend relationship in the planning process with our colleagues, and how we are there to kind of guide them through. And perhaps when a scheme is of a certain quality, we look to encourage good design where we can. And it's how we also address agendas like air pollution, and that the Royal College of Physicians did a fantastic study last year about the effects of air pollution especially on children, and how the toxic street environment has a whole range of negative health outcomes, from the effects of heavy traffic pollution, the effects of poor housing, and how that can impact on children, especially if they live near these areas. And that's not just an inequality; it's an injustice. I mean, when we talk about the Wolverhampton context, we see that with how places have been designed, and especially with regards to green infrastructure. The picture on the left is the Wolverhampton Ring Road, built during the 1960s. Fantastically landscaped, with nice trees and bushes and green space. But would you really want to sit there and contemplate and relax, with 20,000 cars going past in each direction every day? Probably not. And how green infrastructure in city centres has been apportioned in the past, with things like flower pots and things. They look lovely, when they're in bloom, but for about 9 months of every year, there's nothing there. It's just an empty pot. So perhaps there's something we can do to influence, how that's put across. And really talking to our highway engineers and planners about what really dominates our civic environment. This is a couple of roundabouts in the city centre. Wolverhampton city centre has had a lot of traffic reduction in previous years with the closing of some streets and putting up traffic cameras to stop vehicles from going through, to allow buses to get better access. And that has drastically reduced the flow. Is it can you justify having really wide roads and a streetscape and infrastructure that's dominated by very heavy engineered highway solutions to these problems, like lots of guard railing, and tactile paving to stop people from walking across? Is that really the best use of space, in the city centre? So we're arguing that perhaps it could be done better, and we do get engaged in agendas on that. And really, some of our civic environment doesn't encourage places to be. This is the civic centre, lovely piece of 1970s brutalist architecture. But really, the civic centre, it's not really designed as a place where people, they want to sit and relax, because there isn't the infrastructure there. There isn't the seats or the kind of that place-making quality. I think this agenda has been pushed a lot in previous years, and not just by colleagues in planning, but also in landscape design and landscape architects. Landscape Institute did a great paper a few years ago about creating healthy places, and how that links into the public health agenda with 5 priorities for place design. And also in London as well, with the Civic Voice paper on street design for all. Great thing to link to. Talks a lot about how urban realm can really improve streetscape, not just for placemaking, but also those health inequalities I spoke about earlier. And that's been applied in a number of London boroughs with public realm design guidance, that's really kind of led the way and is well worth other areas looking at. And from the public health kind of purist agenda, the Faculty of Public Health has done a lot of work recently on how you kind of ingrain that into looking at the health impact of cars and really how you can design streets and really kind of getting on there from a health agenda, providing the evidence and really looking to add to that. And really, the conversations that we have with highway engineers when we're looking at public realm design, it's a lot of it is about overcoming those barriers to positive health outcomes. If a street is designed in a way that encourages aggressive driving, how can we take that down so pedestrians are more visible? There's less the environment's I'd say less conducive to those aggressive behaviours. That has been applied a lot in London with the removal of pedestrian guardrail in many areas and the reconfiguration of junctions. And really talking to our highway engineers, talking to our planners, talking to our public realm officers about thinking of the streets without cars and how cars have that dominant impact. And how we should design places to be, not just for vehicles to move through. And then it's also about assessment as well. So when we are looking at designing a scheme or assessing a scheme for improvement, are we taking a whole systems assessment of that? So are we thinking about more than just movement, more than just safety, but we're looking at things like amenities, we're looking at natural space, we're looking at social interaction. Those are key elements of good placemaking. And from a public health perspective, the public health outcomes framework, which is our guiding, our measurement document for each local authority, does look at different domains, and green infrastructure can influence those from a variety of domains, not just from the wider determinants about noise and green space for health and social connectedness and community safety, but also about reducing exposures to harmful pollutants and reducing dementia. Those are key elements that green infrastructure can play. And it's great to be joined by two speakers who will both elaborate on that and provide some of the evidence that behind underpinning that. We've applied green infrastructure in the West Midlands in a number of different contexts, and one of those was a scheme which I led in my previous job at Sandwell Council on a very heavily trafficked road, very difficult set of circumstances. It was an urban street canyon. We worked with the local councillors and we worked with local groups and the local school to get the benefits of green infrastructure really embedded there, and we put some in around the school to act as a way of reducing exposures to the school children, who of course are a very sensitive receptor to air pollution with their developing respiratory systems. The evidence was based on a lot of academic research that came out a few years ago now, looking at how green infrastructure can reduce NO2 concentrations in certain areas by 40 to 60%. So this was quite a good piece of research to build on. And of course, there's some nice pictures there about some of the schemes we introduced. Great picture there. Got really good backing from our elected members, and the chap in the left there, he's now actually the leader of Sandwell Council. So it's good that in the future perhaps that will be ingrained further. And from the learning from that, we used wider networks to push that across. And the West Midlands Sustainability and Public Health Network is a network that's been going for a few years now, really based on climate change and looking at health inequalities and efficiencies. And we brought the green infrastructure agenda to that network. We had an event in Wolverhampton. The ears pricked up of some of our landscape architects and some of our kind of our green space custodians, people who work in parks and green spaces. And it allowed the kind of the design of a concept for bringing more green infrastructure to the city centre. Really based on looking at how we can add green infrastructure to quite barren spaces. These are kind of examples I've taken from other areas, really, on what we're really aiming for. So the kind of the living walls approach, perhaps on our civic centre, adding it so it softens the quite brutalist kind of look of it and make it look a bit more natural, I suppose. And also looking at where we can apply it to really address and reduce some of these exposures to harmful pollutants. It's also about as well how we've jumped on getting it ingrained in planning policy, and this is really key because we've worked with planners from across the Black Country to bring in a Black Country supplementary planning document, which looks at addressing those causes by reducing street canyons, looking at areas of NO2 exceedances. And the picture on the left is the city of Wolverhampton borough map, and the bits in red are the areas which exceed NO2 safe limits. And so in those areas, we're taking quite a data-led approach, an evidence-based approach. So in those areas, we will be, the planning policy gives us the ability to perhaps, in new schemes, get the green infrastructure in there as a condition, of the planning application. So really, I just want to finish just on what recommendations I'd make and the learning I've had along this journey. It's very important to bring green infrastructure to urban settings, not just for the reduction of exposures to harmful pollutants, but also biodiversity. Bring that natural space, bring that natural kind of environment to those urban settings. Designing and managing the public realm, that's very important for a sense of place. We're all about creating good place making, and a good place is a healthy place, because it considers all those elements. I think I've repeated myself there, so I won't go through that. But it's emphasising that importance, and ensuring the well-being through design. I think it's very important that we encourage design in our urban landscapes that encourages healthy, active lifestyles. In public health, we're all about prevention, and that's the guiding principle, and guiding prevention agendas, not just in terms of inactivity and obesity, but also things like suicide prevention, from design, and social isolation, very important, and aiming for total street design from that agenda. Looking at the place as a whole, not just individual uncoordinated, components. If you have a public realm strategy that's being written by your planning department or regeneration department, get in there and try and influence it with all the learning that you've had. And green infrastructure is absolutely key to all of this. It's bringing that biodiversity, that wellness, that well-being agenda, and a sense of place to civic areas. And of course, I would say this coming from public health, but we have a major role to play in this, because we provide the evidence. We sometimes provide the drive for these agendas in developing and enhancing planning and transportation policy, guidance and proposals. So thank you for your time. I'll pass you on to the next speakers, but there was a number of acknowledgements there, just from various organisations that I've perhaps referenced in this presentation. Thank you very much. Cheers.
My name is Mike Westley. I'm a landscape architect by birth, it feels, but I'm also involved in higher education and in research. And I'm going to try and convince you today that you all ought to be as well. Whatever your practice is, you should be involved in inspiring others in education. You should try and get yourself involved in research in this area, which I think is critical to our practice over the next few years. I'm going to set the context very briefly. Many of you will be familiar with the notion of a treatment-based model for the health service and how impossible that is to maintain over time. It's kind of symbolized by these rather mysterious crushed up things in the bottom, which will become evident soon, but also by the dominant kind of treatment model that we have. This is a better picture, and one that I think we need to move to, and one that the rest of this performance presentation will draw out. We need a preventative model. It's the only way forward. We can't afford anything else. We need something that is going to stop us and the environments that Debbie introduced, our living environments, being things which actively contribute to dis-ease. That the stresses, environmental, economic and social, lead to the problems which are our overstretched health service. This is exactly the agenda which the Landscape Institute in 2013 sought to address in its paper on green infrastructure. It's a really interesting paper. It's also a free download, so I really encourage you to grab this after this presentation and read it thoroughly. Uniquely, the Landscape Institute said, hang on a minute, it's not just all that everywhere landscape that Richard Mabey talks about. This is a series of landscape typologies that we have to understand that together make up this thing called green infrastructure. Individually, we've got to look at them. I'll be surprised if anyone can read that, but it says assets. Individually, they're assets. Each one of those assets, those bits in the chain, can fulfill a function. So the Landscape Institute's arguing for a relevance for landscape, which has never been seen before. And it's said we've got to work together with a multi-agency approach to maximize the use, the functionality of those landscape assets in a connected network that we call green infrastructure. The report that Richard mentioned earlier, I had some part in editing and putting together some case studies for. It was issued the following year by the Landscape Institute, and it built on all of the research that's been going on for about 30 years in the fields of environmental science, environmental psychology, you name it. It pulled it together and it said, we've got to use this thing, green infrastructure, to attack this issue of health. The first paper of the Landscape Institute was much more general, about ecosystem services and such like. This one focuses on public health. I urge you to download this again, free, from the Landscape Institute. The opportunity we've got now is huge. In 2013, the Health and Social Care Act, for the first time, got the two budgetary areas in government of health spending and spatial planning into the same unitary authorities. It set up health and well-being boards. This is 2013. What are we doing about it? What we ought to be doing about it is working within our health authorities, within our local authorities, and within our businesses, whatever services we commission in terms of green infrastructure, in terms of the landscape around us, we ought to be insisting that there's a public health agenda to the projects that we're dealing with. We ought to be going to our local health authority and lobbying them to be part of the green infrastructure agenda. These projects are just some of what could be happening all over the country as part of a preventative model for healthcare in a new NHS. We've got to move out of this silo mentality of place and health. They've got to be one. We've got to stop looking at these huge areas of nowhere landscape as useless bits of maintenance liability, and we've got to start looking at them as elements of a performative chain of green infrastructure that delivers health. Personally, I've been fortunate enough, and I believe that it's kind of the most successful way of working, to be involved in these three areas of practice. Research, trying to find out what works and work with those much cleverer than me who can go into it in greater depth. Practice, because we simply have to get examples like the one that Richard was talking about. We have to get them out there to convince people, as he was saying, to raise this agenda, to point to the statistics, and to say invest. Invest time, invest money. Education. This is critical, I believe. You can't create a culture which is a total paradigm shift in space and health without a constant waves of people coming up who are programmed to think that way. And I'm going to show you some case studies now from each one of those fields that I'm involved in. I'm working together with the European Centre for Environment and Human Health, all the way down in Truro. I'm from Cornwall. We're working with Cornwall Council, and I'm working with my university in Plymouth to create a tool that works with neighbourhood planning or any other kind of community design project to get people to think about how they integrate performative function into their green infrastructure, whatever it is, whether it's a little village, whether it's a neighbourhood of a town, or whether it's an extensive area of countryside. There have to be things that that community needs, that its green space, public, private, and maybe even voluntary sector owned, can be better designed and managed to deliver. This is what this tool is that we're trying to develop. And broadly, it's going to depend upon the resources of the local authority and other partner organisations. It's going to develop programmes around issues of food and fuel and nature and water and social, to develop well-being action plans that really touch upon the issues that people care about in their lives. It's no good saying green space needs investing in, well, just because it's nice and green and fluffy and full of birds and bees, unless it's actually sort of affecting what people are spending, unless it's actually affecting people's health, education, the way they live. Why should they invest in it? These plans, hopefully as part of this tool, as part of well-being for action plans, are just the sort of things that people need to have a relevance, to realise a relevance of landscape, of green infrastructure to their lives on a day-to-day basis, and to hold them account by monitoring the outputs and checking them against the plans and the ambitions they had. You're not going to read these, but they are on the report if this presentation, if you want to read it later. But basically, these are the outcomes which the Health Trust said they believed could be generated by improved green infrastructure. These over here are from the local economic partnership and local social partnerships about the outputs, their outputs, that green infrastructure could help deliver for them. It's really important that we recognise we've got to make partnerships for action between these different areas. As part of that project, my business sponsored and worked with a fantastic PhD student, now Dr. Sarah Bell, who's looking into this in infinitely greater detail than I ever could, and is very, very interested in the detail of the experiences that people have from landscape. Not just the practical things like food and all the other stuff I mentioned, but whether places allow people to achieve certain things. Whether there are special types of places for social activity. What are they like? How much do they influence people's well-being? Symbolic places, key to a culture, as small as a family or an individual, as great as a village or a town community, and immersive places. Places where you go and lose yourself and find yourself and get inner strength from nature, from green infrastructure. We hope to build this research into the tool and make it deeper and stronger. And you'll be able to read about the new directions that Sarah and her team want to take later. This is that document, or part of that document, that Richard mentioned earlier. And here are the outcomes. It's set out in a really clear way. The Dolphin House courtyard there is actually a sort of healing landscape project, one of my practices. But it's the general lessons of this document that I really encourage you to pick up on and read. Dealing with the determinants of health, dealing with those aspirations, as it said on the Marmot report and the book that we've just, Debbie's just alerted us to. 10 recommendations, really important. A bigger role for public health in placemaking. If they're not at the table, there's a whole agenda gone to waste. Resource commitment, national requirements at a local level, very important. Recognise landscape as an asset. More evidence needed. We really do have to think about what we do in practice. Log it, contribute to a debate, get involved. I said I was going to talk about education as well. This is part of my educational work at the University of Plymouth School of Architecture, where my bosses have been kind enough to allow me to set up programs in green infrastructure design and management with postgraduate and undergraduate architects, which for me, as a landscape architect, a horrible gardening greenie in their midst, is a real triumph. We're now working in the Falls Road area of Belfast with some culture and community organisations there, looking at how we can regenerate areas around what they call the junk space of the peace walls. These particular students were looking at a project to open up the waterways, the hidden waterways and hidden rivers of Belfast and the Falls area. These other students were working on things as diverse as using those spaces to encourage urban bee group growth and honey products, or over there, a rejuvenation of the flax industry. Wherever they go, those students are meeting real people in real places, dealing with agendas which they will never forget, which are outside of the walls of their narrow buildings, which they will all also build, but I hope they recognise as crucial to what they do as the buildings themselves. I've worked a lot in trying to raise awareness for green infrastructure, and I think the nature of relevance of landscape to people's lives is key. That's why I've been really excited to work in the good old days with Cave Space in the development of the tool called Space Shaper. Any of you remember that? I believe that Space Shaper and tools like it are key to this issue of well-being, because well-being is about people recognising a connection to their place and then working with a detailed understanding of their place to achieve positive management, to reconcile polarities between different user groups, to take forward a green infrastructure, a place which is supportive of all. So I commend you to, another free download from the Cave archives, now stored with the Design Council. These are more detailed and are more what we might think about as healing landscapes. I get involved a lot in education, and where possible, like this example of a standard junior school, mostly tarmac at the beginning, they decided they were going to be 80% of their learning was going to be done outside. They were going to generate their own food. They got a lottery award for their project Cultivating Futures, and they're entirely wedded to that vision. This in itself inculcates this understanding that as people in a society, we have a right to expect this kind of performative, well-being giving support from our landscapes. We have a right. And hopefully all those children are going to grow up feeling they have that right. Aldo van Eyck said when he was restoring Amsterdam after the Second World War, no city can call itself truly civilized unless it offers places for its citizens to play in. We're not Homo sapiens, we're Homo ludens, the ape that plays. I think play is critical to well-being. I think whether you're young or old, I'll stop hitting that, whether you're young or old, playing is a way of discovering. It's the most fundamental way of learning and of building a relationship to a place, to green infrastructure. In our play projects, like this one in the North York Moors National Park Visitors Centre, we've tried to make it as interesting as possible to learn about the aspects of this incredible landscape through play for grown-ups and children. This is another play facility, a public realm space, this time in a major general hospital. But it's one that encourages people of diverse abilities to all enjoy the same place. I believe inclusion and inclusive design is critical to well-being orientated green infrastructure and placemaking. This was designed by the clinicians in the hospital, by the parents and user groups, and by the townsfolk around Truro, where this is actually based. Once again, in Cornwall. Hurrah! This is what you'd commonly think of as a healing or therapeutic garden. It's a tiny courtyard designed to support the therapy of incredibly talented and wonderful practitioners who work with all kinds of areas of children's health. It doesn't really look any different, and nor should it look any different, to some of the other places that I've shown you as part of this presentation. And that for me is deliberate. I started off with Debbie thinking that I was going to talk about this sort of thing, this detailed health environment project for the whole of the presentation. But I realized actually that that's not very helpful to the notion of true healing delivered through green infrastructure and true well-being, which must be part and parcel of all the thought we give when we're managing this type of resource. And I'm going to leave you with this notion of a healing, therapeutic, green infrastructure being consciously delivered, saving a health authority a whole bunch of money through wiring some of its funds into delivering in an area where it knows its outputs will be sorted. Thank you very much.
IBI Group is a design and technology business. Our headquarters is actually in Toronto in Canada. So it brings a certain amount of international perspective. And I'm going to start by just putting my presentation in context of towns and cities and where we think they're heading. So in the first column on the left, we've got, I suppose, something we've moved away from, the idea of the functionally zoned town where homes and workplaces are all split apart. I think most people have now embraced the idea of a mixed-use place where different functions are brought together and make more diverse places. But where we're heading is, I think, a place which aren't only mixed use, but they're multifunctioning, where same spaces might have different functions at different times, and where the impact and power of technology is overlaid with the spatial layout of places to actually allow them to be working in much more sophisticated and complex sets of arrangements. And so because of that, my take on infrastructure is actually a very broad one. Just about everything comes into infrastructure in one way or another, and hopefully we'll be able to discuss some of that. Now, I'm not going to go through this in great detail because luckily Richard and Michael have actually done a much better job of scene setting than I can do. But I think the point to make there is plenty of evidence about how the environment impacts on people's health. There's no shortage of it. The shortage is how that could be linked to policy and actually to design approaches and to make change. So what we're finding is that for a whole variety of reasons, we're making places in too many instances that actually make us sick. So the next time someone says, I'm sick of this place, well, they might be speaking a bit more literally than they imagine. places that don't encourage people to exercise, not because they're not going to the gym, but as part of their daily routine, because that's what they need to do. Going to the gym once a week probably isn't going to do it. It requires people to do it as part of their daily routine. But if it's easier to go around by car, you're not going to be walking, you're not going to be cycling, you're not going to have that active mobility. If you haven't got access to open spaces and nature, well, we've just heard about the power of that, not just for health, but about people's psychological well-being as well. And mental health should be given equal weight as physical health throughout all of these factors. Simple things that town planning started out with in the 19th century is bemoaning the quality of light and air and water in our cities still is a problem, particularly air pollution. Access to fresh food. If it's easier to go to a takeaway store than it is to get fresh food, then no wonder we've got a growing problem of childhood obesity. But also issues about how we put places together that make it harder for people to establish social networks. Socially cohesive places where people know their neighbours, where people can actually grow in a place, put down roots and actually get to know people is incredibly important for both their psychological health and well-being. Poor housing, we're still paying out as a country a fortune in payments to people but to compensate them because they're being forced to live in rubbish housing that doesn't meet modern standards. And environments which are disorientating and confusing for people, when we've got a growing problem of dementia, these are major issues in terms of the way we make places. And finally, but it's every bit as important, we've had decades now of increasingly centralised healthcare provision. That is breaking down, as we've already heard. There are significant problems around whether the NHS can sustain that model, and what do we do, and what are the alternatives. So in our little diagram there, we've just tried to relate health issues with the people and the demographics and the sorts of scales of places. So that's one way that we use to structure and organise information. And another little tool is this little spider chart, which we just use to compare ideas and compare places. And basically what it tries to do is to distill out the fundamentals of what we're trying to get to, but put it from the citizen's perspective. So rather than the healthcare provider's perspective or the local council's perspective, what does it mean to the citizen? And they're healthy if they can have an active lifestyle, active in both mind and body, very important. So they're stimulated. But that needs to be sustained. You can't have the output without the input. You've got to have good food, nutrition, you've got to have air and water. And how to be independent. We want people to have independent lives. We need to be able to support people so they can age in place, so that they still relate to the networks of friends and family. They're not taken away from those when we need to provide them with additional care and support. And the last thing we want to do is be bundling up our older people and putting them into some sort of grey ghetto where the only other people they see are other old people. But that has to be supported. They have to be supported through efficient and effective health and social care regimes. And how is that going to happen? But also, I've also included their spiritual support and their financial and economic support as well. So seeing these things from the point of view of the citizen, and how do we make empowered citizens within this process? Again, I won't go through the whole detail of this, but I think it's about creating a holistic overview about how the citizen fits within the future city and their place within that and the infrastructure that they need to support them. And it raises a question. I think the idea of a new paradigm has already been raised, and I think let's pursue that a bit more. We are at the point where we now have the sorts of assistive technologies which would allow more people to be treated and monitored at home, which could be immensely powerful for people in terms of the quality of support they get, their quality of life, because they're not taken away from their friends and family, but also for the efficiency that that can mean for healthcare providers. Those technologies are out there already, and in many places they're actually already being started to be implemented. We could see a transformation from being a bed in a hospital to being your own bed in your own home. And the technologies that allow someone with a chronic or long-term condition to actually still be supported within that much more friendly and familiar environment. I think that'll be a growing trend, and one that we need to think about when we talk about infrastructure, to actually provide for the technology that goes in terms of the way that new homes are kitted out and the sort of infrastructure that we build into communities. So I'm going to round this out with one case study, which is a project which we're currently working on. So this is work in progress. We by no means have all the answers yet. But one of the reasons I chose this was, I think when people talk about green infrastructure and health environments, perhaps in the back of their mind they're thinking about leafy suburbia, because it's very easy to think in a parkland setting about how that can be healthy. But the pressures on local authorities up and down the country, but particularly around London, the South East, from market pressures, from planning policy, and simply from the shortage of appropriate land for development, means that densities are being driven up. So can we make healthy places at high densities? That's going to be the real challenge for our societies. If we can do that, then I think we've actually got a real chance of making places that are both viable, can be delivered, will meet our wider social needs and our individual needs as citizens. This is an area in Southend in Essex, and you've got the town centre and a big shopping centre and a mainline railway station at the top of the picture there. And you've got to the right, you've got the sort of suburban hinterland of typical sort of two-storey housing you get in many towns around the country. And right at the intersection between the two, they're divided by this huge bit of post-war highway infrastructure. It's a monster. So someone else, Richard, you were showing a bad road earlier. Well, I think I've topped you. This is about the worst bit of road I've ever seen, actually. And they've also got some nice big post-war housing towers there, which are at the end of their life, and they need to come down and be replaced. So this is a close-up. You can see what this means to this community. It's not just the movement severance that this creates, that you can't get across it, although it's an absolute nightmare for pedestrians. There's a pedestrian bridge through all of this, but actually people prefer to take their life in their hands and run across the roundabout rather than go down it. But actually, there's issues of noise pollution continuously, 24/7. And there's issues of terrible atmospheric pollution. I mean, people who live around here cannot leave their windows open without getting a build-up of black dust on their furniture, because this is coming from this road. The result of that, stress, illness, isolation, lack of exercise, all the things that I've been talking about. So what can we do about that? Well, I think it needed a really radical approach. So that's what we're talking about as a future vision for this area of what it might be like, where we basically deck over a big piece of that road infrastructure. We reclaim it back as public space. We green it. We get development around it, and we make it a pedestrian priority space where cars come in only when they're required for servicing function and access. That means pretty radical sort of engineering. So that's the sort of sections we're talking about. So this is the road. We build across that. We put development around it, and we try to tame that. We're talking about something in the order of about 1,200, 1,300 new homes, 3,000 square meters of other uses, local shops, community spaces, but fundamentally restructuring the area so that we create walking routes through this, so that it's good for the pedestrian to get from the residential hinterland in the top right into the town centre in the bottom left, with clear, legible routes that you can walk across this, where we manage car and traffic to access this only as needed, and we create opportunities for play and a green space throughout the scheme. And this is just an early visualization. Again, very early days on this, but this is one way it might be structured. And just one factor that we've tried to build into this. We wanted to make sure that everyone had access to external open space more than had been typical for this sort of high density development. So we've aimed for roughly double what you'd normally expect, an average of about 10 square meters per unit, more for the big family units, slightly less for the one bedrooms. But everyone has access both to balconies and roof terraces and communal spaces. And what we wanted to do as an objective for that is to say there should be an opportunity for people to grow things. Not just to be able to stand out in the open or hang their washing out, but actually to be able to grow things. So we have planter areas that we're talking about where you can grow things, so you can grow vegetables and grow food. It's a modest thing, it's a small scale thing, but I think we work on the basis that every bit helps. We also have rainwater harvesting we're talking about, so we can have irrigation from that, from recycling that sort of water. So we make a place that has a series of accessible green spaces throughout. And then again, very early visualization. I think the foreground is we want to have something a lot greener and softer than this suggests. But thinking about things like light, getting into flats, no north-facing single aspect apartments, so everyone gets at least a bit of sunlight for part of the day. But also thinking, well, actually with climate change, actually too much heat is actually going to maybe become more of a problem than actually heat loss. So actually, how do we break down too much penetrating sunlight? One of the things which this visualization doesn't yet show, but we're exploring is, can we even grow plants up the skins of buildings and use the plants to filter light and control the amount of light, but also use the plants to filter air so that we get a double benefit from it and use those types of things. So those are the sorts of ideas that are being explored and many others, I think, to make a healthier place. We think it can be done at those sorts of high densities. It's not just a suburban issue or a suburban solution. Thank you very much.